everyone. Today we're here with Dr. Helen Wiltshire from True. Today we're going to be discussing the difficulties of falling pregnant, which I think could be quite an emotional subject for some ladies.
Really is.
Yeah. We also are going to be talking about Polycystic Ovarian Syndrome and how that impacts on the pregnancy also. When you're looking at falling pregnant, what is the normal time frame of falling pregnant for couples?
Yeah, so for healthy young couples, it can take up to 12 months to fall pregnant without there being any medical problem.
That's amazing, isn't it? I think a lot of people, they'll try for a couple of months and then they'll get worried.
That's right. We see people after 2 or 3 periods and they're anxious that they haven't conceived yet. But really, for many people, that's too soon to be concerned.
To be worried. So what steps can someone take to get into peak baby making condition?
So it's a great idea to come and see a GP when you're planning a pregnancy.
Yeah.
So there are some really obvious things like not smoking, avoiding alcohol and other drugs, making sure that people have got a healthy diet, doing some regular exercise and being at a healthy body weight.
Yeah.
Other good things to check are to talk about any regular medications that you might be taking. It could be a good idea to stop some of those in pregnancy or change some of those in pregnancy, and also to check immunity to infections like rubella, so that if people don't have immunity or their immunity is worn off, then they could have a booster dose of vaccination.
If someone is finding it difficult to fall pregnant, what are some of the outlying reasons for this?
So looking at getting pregnant as a couples issue, so probably 45% of fertility problems are a female factor. So that might be women who are not ovulating regularly. About 45% can be male factor, so it's really important for blokes to have a checkup as well. And then the other 10% probably are combined male and female factors together.
And you can get those ovulation kits. You can just get them at the chemist.
Yeah, you can do those. Probably a good idea to talk to someone about how you're using them, because for women with very irregular cycles, they can be a very expensive way of trying to work out what's happening.
Right, okay, so go and see your GP. Another thing that we'd like to talk about is stress levels. Would that impact, how much can that impact on falling pregnant?
It's difficult to say. I think all of us know women who haven't conceived until they've reduced their stress levels. But on the other hand, women who are living under chronic stress who get pregnant even when they maybe hadn't planned to. So again, that's a very individual situation.
And what about the guys? Is it common for the male to be the source of difficulties in becoming pregnant?
It certainly is, Nearly half of couples' fertility issues are male factor. So that might be things like a low sperm count or low sperm quality. Sometimes there are genetic factors at play.
And that's quite an easy one to rule out, isn't it? Really, for men. It's quite
Having a talk with their GP, seeing if there's anything in their history or medications or things that have happened to them in the past that might impact on sperm production, and then doing a sperm test or semen analysis can give a good answer quite quickly.
Helen, changing the subject slightly, what is PCOS and how can it affect fertility?
So PCOS stands for Polycystic Ovarian Syndrome, and it can affect fertility because women with PCOS don't ovulate regularly, and of course you need to ovulate in order to get pregnant.
So is it common?
It is really common and probably becoming more common. It's more common particularly in some groups. Aboriginal and Islander women seem to have a higher rate. And Pacific Islander women too can have a higher rate of PCOS.
How would someone know if they had PCOS?
There are some symptoms and signs that women might experience that might indicate PCOS. So those typically can be irregular or no periods, difficulties getting pregnant. Often women will have trouble with excess body weight, and also some signs like body hair where they don't want it, it's on their face or chest, and acne as well.
Interesting. If someone thinks that they may have PCOS, what would they do?
So getting some investigations with your doctor, with your GP or women's health doctor is the best place to start. They can talk to a woman about her symptoms, about how her periods have been, whether she's had any of those other symptoms, and look at some tests, ultrasound and blood tests to help confirm the diagnosis.
I received a couple of questions from the community as well. So what they were wanting to know is, the first is about age, specifically Does fertility decline with age, and if so, when?
So yes, fertility does decline with age.
Yeah.
It starts to decline about 30 and then declines more sharply after 35. Yeah.
Okay.
Of course, doesn't mean that you can't get pregnant then, and if people don't want to get pregnant, then that's time to use reliable contraception.
Yeah, that's right.
But it can be harder to get pregnant the older women get.
Right, yeah. Next up is a question about spacing between pregnancies. Is there a minimum or right amount of time to wait before becoming pregnant again?
So I guess you can think about this question in a couple of scenarios. Perhaps if someone has had an early pregnancy loss or a miscarriage, then they don't necessarily need to wait any length of time before they try again. If someone's had a healthy baby, then it's probably a good idea to give yourself at least 12 months, 18 months in between pregnancies.
Yeah.
So that your body's got time to recover and that you've got time to nurture your new baby. Yeah.
Your mind has time to recover as well.
That's right.
Does having several miscarriages affect your chance of having a healthy pregnancy?
I guess that depends on when those miscarriages have happened. If people have had only miscarriages and not had a successful pregnancy yet, then that would definitely be something that should be looked into by the GP and potentially the gynaecologist. On the other hand, if a woman's had successful pregnancies and had children and then has some miscarriages, that's going to be less likely to indicate a long-term problem.
Yeah. One question I'd like to know is what is PCOS? Like, what actually is it?
So it's a cluster of symptoms and signs. It includes women who don't ovulate regularly, who've got some changes in their hormones and in their metabolic system. So not only does it include those things like irregular periods, acne, increased hair, increased body weight, but it can also include things like insulin resistance and pre-diabetes and increased risk of heart disease and so on as well.
So what happens? Like, what is it? Is it a cyst on the ovary or is it something different to that? What?
Yeah, so the hormonal changes stop the ovaries from working properly. So that in a normal cycle, the ovaries develop a number of follicles and one of those will go on to mature and release an egg.
Right.
In PCOS, lots of follicles start to develop, but none of them actually get to the point of making and releasing an egg. So that on ultrasound, you can see lots of those little follicles, or sometimes they're called cysts, on both ovaries, but none of them maturing to release an egg.
Right, okay. How interesting. Thank you. It's a very interesting, and there's so many different reasons, isn't there?
There are lots of reasons.
Yeah. And I suppose that comes back to consulting with your GP, making sure that you're having those conversations, because everyone is it's so unique to their life and what's happening for them. So it's really important to make an appointment with your GP. Jump on to true.org.au and check out the information there. If you have anything to add, pop that in the comments below. Let's keep this conversation going and let's bring more focus to this issue, because it's certainly something that affects so many women. Thanks so much for watching, and we'll see you soon.